Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 5, Operational Excellence in Healthcare, for the Chapter 57, we will be studying today the strategies for effective communication in healthcare. We have seen in the previous chapter the different types of communication, the errors and the improvement, and with respect to effective communication, how it has played a major role. Now, we will be seeing in today's discussion about a case study of Mr. Kumar case and effective communication among employees of a healthcare organization and levels of communication and strategies for a quality improvement. So now here also we will be discussing about Mr. Kumar's case. In this case particularly, there is a communication which has been seen with a patient, a cardiologist and even a technician. So a doctor is being seen with discussing actually being seen as very busy actually. And when the patient tries to have a discussion or a question, what is the communication failure Mr. Kumar has seen? Mr. Kumar, as a patient or patient's relative, has been seen over here who is asking the doctor, please spare me a few minutes, I am confused. So what is Mr. Kumar over here communicating and what the physician is stating? The physician is stating that I am on my way out and I can't wait. Didn't you see the cardiologist? Because he is saying that you need to see the cardiologist and I am busy and haven't you seen? Means like there is no clarity that Mr. Kumar has got and that's where Mr. Kumar is confused over here. In the second incidence, you can find that the physician is calling the technician. He is stating that the patient is confused, Mr. Kumar is confused, and it is about the angiogram that has been advised. It has been asked that the patient should go to the cardiologist. The patient didn't understand, Mr. Kumar didn't understand what to do and what to call upon. And then the physician has called upon the technician and he said, explain it to the patient, explain it to Mr. Kumar and call the technician. He said, technician, come to the wellness clinic now. And your boss says so. He was so irritated that the physician called upon the technician. He was expecting, the physician was expecting that the technician should explain actually Mr. Kumar, the patient or patient's relative, that how he needs to go with the procedures. So what did he say? The physician said to the technician, why don't you explain the procedures to the patient? The patient is confused and this is not my job actually to communicate. Ideally, the physician could have also communicated or who could have also given the time to the patient, Mr. Kumar, and he could have explained actually that what is actually the case is dealing about and why he need to consult the cardiologist. The technician said that, sorry sir, I didn't explain. I can do it again, and this is how the communication is being sorted over here. So what is Mr. Kumar's agony over here? He is saying, sir, it is not his fault. Mr. Kumar is saying to the physician, and he is saying that it is not the technician's fault. He has already explained me, but I wasn't listening well. He acknowledged that he didn't understood or it was a confusion on his part or he was not getting a clarity. So the physician was being seen as stating that both of you meet your busy cardiologist tomorrow. So it was a scene being seen as a communication failure which has reflected with the relationship of a patient to a physician and a technician and an unnoticed cardiologist over here. Now, with respect to effective communication among employees of a healthcare organization. As we have already cited the importance of effective communication in the previous chapter, and let me now take you how it is among the employees of a healthcare organization that the effective communication is being seen. Healthcare professionals must practice effective communication. They need to work on improving the effective communication, as it has been seen that this skill among themselves is to be used more and use the appropriate systems for effective communication. It is very important that effective communication need to go in the system with respect to their superiors or subordinates and even peer. People at their level, people below the level or people at their higher level, it is very important that the healthcare professional need to practice the effective communication. Here in the chart over here in yellow, it is being shown that how a CEO or a medical director in the hierarchy comes down to him or a nursing director, the communication flows downwards. Okay, The medical director in a diagonal communication can be seen giving a directions towards the nursing department and even the nursing department head 2 or nursing department head 3. The nursing director can also give an downward communication towards the departmental head. Where versus the medical director can have a communication which is being seen as an horizontal communication to an HOD or even different departments HOD, which can be seen as an downwards communication, and communication which is from the nursing department head or nurses towards the nursing director and towards the CO can be seen as an upward communication. What are the importance of this? The importance of this, like this communication within an organization can be functionally categorized into formal and informal communication. Formal is something which is more put in papers, more put through a proper channel and can be seen with respect to purpose. Informal is something which can be with a sort of a, sometimes as a reason actually, or sometimes it is more based on the biases, or sometimes it is more with the signages, or sometimes actually with the signs that can be seen as an informal way of communicating. And it creates both a way an impression to the healthcare provider when they are communicating with each other. It is more based on the trouble actually that they face because of the hierarchy. It is divided into vertical, horizontal and diagonal communication to make it more clear. Let us see now over here what is horizontal, that is lateral communication. The staff or a peer versus to a staff, there is a communication which can be seen, that a communication between employees to employees at the same hierarchy level, and this is facilitated through a coordination and a cooperation actually, which can be seen as something as a horizontal communication which goes from one employee to one other employee of the same hierarchy level. With respect to the case actually that we have seen of even Mr. Kumar, and even many times it has been seen that with respect to the hierarchies, it is like a perceived superiority, that with respect to the age or a generation or the business of the personnel at a hierarchy level, where in the case of the physician referring actually to a specialist, might be a urologist or a cardiologist of the specialty, it is hindered that the communication is because of the generation, by the culture, by a gender, by language and by status. It is very important that there might be some sort of prejudices actually which needs to be erased actually through this, and which needs to improve. The case study has reflected that the physician and cardiologist communication failed due to perceived hierarchy. The cardiologist undermined the physician, leading to hostility and poor patient care. So it is more because that the hindrances are being seen because of a perceived superiority, which might be because of age, specialization, and busy. What is the solution for this? The solution for this lack of communication is like training the staff to respect each other, which is very important, that you need to have a professionalism actually which gives a respect to other, who can earn the respect at a time actually to make a healthy work environment. Second is like we can see the vertical communication. Vertical communication is communication between superiors and subordinates, which is involved an upward or even a downward flow. With respect to downward flow, we can see that the top managers are communicating to the immediate supervisors and staff, and the purpose is like instill a greater degree of trust and greater desire for communication, which is very important, that we need to have a downward flow. Where even at the upward flow communication, we can see the subordinates, the superiors, we can see that the content is more like a feedback, emotion, request and problems at a work, where the importance of this will be seen as necessary for creative and effective decision making in the healthcare organization. That if you find that the upward communication flow is being seen from the staff subordinate towards the immediate supervisors, and from the immediate supervisor to the top manager. So it is growing from a ground level worker actually to a top managerial worker. So the workflow is being stated with the set of an hierarchy which gives an order, but with respect to communication, if it is to be listened from the down actually to the top, which can be seen as an upward flow, is one which we can be state as a very effective way of dealing with the challenges which the subordinate faced while they are communicating to the superiors, rather not a communication which is coming directly from the superiors to the subordinates, being seen as an order actually. What is a diagonal communication, and what are the examples of, with respect to that? A communication between managers and workers located in different functional divisions. Suppose a division of emergency room is being stated over here, and the manager or emergency room director is communicating with the worker, the emergency nurse actually. And a division of a cardiology on the other side is communicating to the worker or a nurse in an emergency department, where a cross-functional communication is done with the cardiology chief or a manager over here and a technician. So you may find a cross-functional and cross-hierarchical flow communication also is very inevitable in the healthcare organization. And these communication managers and workflow are located in different functional divisions, and you may find lot of diagonal communication is being seen, and which needs to be very important to come across the biases or across the hierarchical pressures actually, which affects the diagonal communication also. In the hospital setting, the example of multi-specialty team, you may come across emergency physician, radiologist, cardiologist, urologist, surgeon, gynecologist or cardiologist. But for a patient, actually the patient requires is the multi-specialty treatment for the comorbidity or the condition. So the healthcare team needs to coordinate, they need to come with a convergence actually to make it more a diagonal communication, which is more from one division specialty to other division specialty, which we have seen on the other side of the picture. The case study over here is that how negative diagonal communication is being seen. When the physician vents frustration on a lower level colleague in a different department, creating a poor impression on the patient, which can be seen that the patient was very passive aggressive and lower level physician was from a different department, venting frustration unfairly, and what it has led, poor impression and demoralizing the patient. What it has ultimately lead, it is to the soft target that the patient is affected because of the poor diagonal communication actually among the two staff in the hospital, where the physician was passively aggressive and was being seen that towards the physician on the lower level at a different department, which was venting a frustration which was very unfair on the part to be seen, and which is very important that this type of negative diagonal communication is seen in many of the instances in our hospitals. What are the levels of communication in healthcare and the strategies for quality improvement? The level of communication and quality link, that is the patient provider, provider to provider, and provider to organization and organization to patient. This links to the quality means with respect to the errors and often occurs at interfaces, and you may come across that lot of chances that we may find that it compromises the quality part. So what are the strategies for quality improvement over here? The first strategy can be seen as a structured communication tool, which is saying the SBAR. That is situation, background, assessment and recommendation, which is a very important strategy which is based on interlinking actually or using a handover, escalation, emergencies. Those level this strategy works very fast, very effective, and the quality benefits that you can get that reduces the ambiguity and improves the clarity among the communication. What is the framework? The framework is being identified as a very standardized framework actually over there. The second strategy is that standardized handover protocols. If you see, if the hospital is working on this strategy, it is being important to say that it is very importantly being identified as a way of continuity of care. The tools can be the ISBAR and the checklist, which plays a major role actually in improving the handover protocols. Quality impact can be seen as reduce adverse event and improve patient safety. And this is a very important way of dealing actually the strategies of quality improvement. The strategy 3 can be active listening and empathy. We have already discussed in the previous chapter that this can be identified as a safety tool, which is more linked with open-ended questions which are more subjective, and there is a clarity that it gives a non-verbal cues that how you are working more towards a patient's understanding. The link can be patient satisfaction is more, and it reduces the complaint from the patient or patient's relative. What is the strategy 4 over here, which teaches teach back method? This is being identified from a theory which has been developed to be seen as what if the patient explains back. The patient explain backs gives a conformity actually to understand the provider that yes, the patient has understand or patient's relative has understood it properly. It can be with respect to medication information, it can be with respect to doses, it can be even with respect to discharge or even to follow the instruction. And teach back has been proved as very effective in healthcare communication. The quality outcomes can be better adherence and fewer readmissions, and it can reduce the out-of-pocket expenditure for the patient, or even it can improve the referrals. The framework is patient comprehension and empowerment, and it can be seen that the better health outcomes are more when you empower your patient, when you comprehend your patient with the information. And it has been seen as a very effective health education tool. Now we move towards strategy 5, that is breaking bad news, the spikes actually, where you see lot of vandalization, lot of miscommunication, and the trust and validity of the healthcare providers are being questioned. The spikes comes when there are more in terms of the settings, perceptions, invitation, knowledge, and emotions and strategy. So you may come across lot of spikes which has to be tackled actually with respect to all the spikes which comes into oncology, diagnostics, critical care, ICU, emergency department, where you need to understand the ethical and quality relevance way of dealing with effective communication, which can improve your way of dealing with the patient when you have to tackle the breaking bad news. Strategy 6, discuss with interprofessional communication team. How the interprofessional communication and teamwork can improve the respectful communication, flattering the hierarchy actually, which is very, very important. When there is a flattening of hierarchy, it is very important to be seen that it bridges the gaps. It is a method that can be used by team briefing, give them debriefing, or sometimes multidisciplinary rounds can be called. What is the framework used? It is a culture of safety which gives you more accountability, which gives you more reasoning actually to come and discuss and to plan to improve interprofessional communication. Strategy 7 emphasizes more on health, IT, and digital communication. Nowadays, with the help of the technology and increasing need for that, you need to have tools like EHR, electronic health record, clinical decision support, alerts and reminder, which gives you more benefits to be used from the help of technology to bridge the gap of the communication. The risk may be poor digital communication. If at all your systems are not poor, your systems are not prepared, it can be a poor digital communication. What is the quality link? It is like accuracy, traceability, and accountability can be the one among the benefits that you can get it from the health, IT, and digital communication, and these are very important nowadays to improve and see the benefits. The strategy 8 can be training, policies, and organizational support. This has been found as a very traditional way of dealing with improving the communication on training the people, which can be in-house or can be on deputation. Standard operating procedures and protocols are one very effective way of dealing with the issue that how an organizational support can be done when you are teaching your staff actually towards to adhere for the SOPs or prepare SOPs and to meet the protocols. What is the leadership role? It is just like developing a just culture which gives somewhere or the other an effective way of understanding and can create a culture actually which is more towards a fair and clear practices actually, which needs give a culture of respectfulness, and it improves actually that you are making an accountability, or you may find the role of every person in the organization that they need to work on the fairness. The framework is more like system level strategy, and this has been a very important way of dealing even in public health professional, that they can see that a just culture being seen as a very important way on organizational support, and organizations who are working to learn from their experiences are one which are effective dealing with these issues. So the most impact of effective communication is on the quality outcomes. The quality outcomes can be improved patient safety, reduced errors and litigations, and better patient satisfaction, which is very important when you find that the improved staff morale is directly linked with communication and it results into better clinical outcomes. So the effective communication is not a soft skill, and it cannot be only seen as a tool, but it is a core quality and safety strategy in healthcare. And this has been found as very important that when you are improving the communication, whether it can be between a patient and a provider, or a provider to a provider, which is the interprofessional, or a provider to organization, or to the administrators, or organization and the patient, this all is linked with quality, and this all is linked with improving the patient safety. So the workplace communication, personality and training in healthcare, which I have emphasized in the previous slide, that how a personality and role is aligned. where we sometimes see that there are people who are being identified as extrovert and they don't go socially actually or mixing, and there is a very less social stratification on their part, where versus it is being found that there are some extroverted people versus to the introverted, actually they may find that they come up actually with a thoughtfulness and industriousness, which sometimes they find that it comes as a one which is helping actually them also for the meticulous working the staff role, versus to extroverted people who may find that they are one who are meeting new people. So these are the personality trait and how they are aligned with this. So identifying the personality types and the team strength and the shine support, you can work on introverted versus extroverted people, and the systematic and strategic communication, which deals is more like the effective communication process, that is systematic implementation, is like patient satisfaction being found very increased when you come up with the effective communication process. The complaints goes down, you see zero litigations, and job satisfaction also increase, where the patient satisfaction is directly linked to the job satisfaction of the employees. Communication is a systemic and strategic issue which is more focused, that it has been found very improving actually when you give ongoing training to them, which can be from sessions, follow-up, workshop, and which are one a way of a booster actually to this. Improved communication efficiency and effectiveness has been seen as very important way to be dealt as a strategy for the effective communication. And lastly, the think and the reason actually that you need to have a healthy or a very good workplace communication is more towards developing a quality in healthcare culture. So with this, we come an end to this chapter, where I would like to state in summary that effective internal communication in healthcare occurs through vertical, horizontal, and diagonal channels. We have seen the different channels and the enabling coordination, teamwork, and continuity of patient care. The breakdowns in interpersonal communication, often driven by hierarchy, poor attitude, and time pressures, can demoralize the staff and negatively affect the patient experience. Horizontal communication supports cooperation among peers, while vertical communication allows feedback. It allows the trust building and even effective decision making. Diagonal communication is critical in multidisciplinary care setting, but must be respectful to avoid conflict and confusion for patient, where it has been seen that when the diagonal communication from one department to another department, if it is not effective or very poor, it can lead to a lot of issues. It can lead to a poor impression on the patient. So strengthening the organizational communication through training, supportive culture, and clear handover process can improve the just culture. Also, it gives improved staff satisfaction, which is directly linked actually to the patient satisfaction, and also gives patient safety and quality of care. So with this, we come an end to this chapter, and thank you for the patience listening.